physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about 3 common ways your hip can cause your knee pain. This has been a little bit of a surprise to me, Brad. I actually, a couple of years ago, I had a friend who was having so much trouble with his knee, especially when he was golfing.
Ooh.
Big problem.
Yeah, got to take care of
He
that.
actually has some shots into his knee, cortisone shots.
Mm-hmm.
Finally, he goes in, that's enough, I'm going to have the knee replaced.
Sure.
Goes in and they go, your hip is the problem. You're having all the problem with your hip. They replaced his hip and his knee pain went away.
There you go. So you really got to be thorough on your assessments.
Yes, you do.
You know, the doctors, they do, therapists do, we all do.
So I'm going to mention a couple of research studies.
Okay.
Khan et al., Khan.
What's his first name and what's his last?
I don't know. That's how they tell studies. Khan et
I
al.
know. I was
Looked
just
at
making
60
fun.
patients, and these patients were scheduled to undergo hip arthroplasty.
Hip replacement?
Yes.
Mm-hmm.
And of these patients, 69% had pain on the front of the knee on the same leg.
Okay.
So they had arthritis here, but the pain was felt here.
Okay.
And here too, I think.
Sure.
But
Yeah.
so
So then which is the problem, I suppose, is a
right.
question.
And of those 60 patients, 47% also reported pain below the knee.
Below the knee.
Yeah. Crazy. I can refer down that far.
Yeah. Well, I don't want to get in. I had another story, but we better get on with the
All right.
program.
In another study, Wang et al., they had 255 patients with hip pain and knee pain on the same leg. So they had hip and knee pain.
Yep.
They did the hip arthroplasty or replacement,
Yep.
and the knee pain commonly improved, almost in most cases.
Most cases.
Yep. So, one test you can do, real simple, to find
Okay.
out, if you maybe have arthritis in your hip, is to sit on a higher surface like this.
So your feet are
Yeah.
dangling.
You're going to check internal rotation of the hip. And what you do is you just move your ankle out like this.
Swing it out. Yep.
So you compare it to the other side. So like if you're like way up here on one side and this side only goes this far, you got some restriction there, which may be due to arthritis.
And maybe pain associated with
Maybe
that.
pain,
Okay.
right. If you're,
So again, these are one of those tests that it's not
no,
100%, but it indicates that there's a
Right.
problem, and it's always good. It's nice when you have a hip or a knee, you can compare one side to the other. Hopefully
all right.
one's good.
Well, let's continue.
Oh,
And
yeah.
the hip is still a problem here. What happens with your muscles of the hip? Some are weak.
Mm-hmm.
So if your gluteus medius, or your gluteus maximus are weak, they can actually cause the bone of your thigh to internally rotate like this.
So that knee will go in towards the other leg.
Yeah, so those muscles help pull it out like this.
Mm-hmm.
So if you're habitually turning your leg in like this can affect the IT band.
Mm-hmm.
It can give you pain there. It can affect how the patella or kneecap lines up.
Sure.
That can give you pain. It affects how your infrapatellar tendon lines up.
So essentially, it kind of throws off the whole knee joint mechanics.
It does. It throws off even the ligaments. The main ligaments are
Sure.
off. So if you're going to want to specifically strengthen that muscle. I'll show you at the end how
Okay.
one exercise you can do for that.
Okay.
So we'll keep them around just to see that.
They can fast forward. Everyone knows that nowadays.
All right. One final thing that can cause knee pain, and again, is that your hip? Like we talked about, is when you walk, when I take a step like this, and I'm looking at this hip right here, look right when I take a step forward like this bone is in effect internally rotating.
So when this leg is behind you, this leg rotates
Right.
inwards
Right.
without you being aware of it,
Right.
really.
The problem is if you lack that motion,
Mm-hmm.
which you often do with arthritis, that motion has to come from somewhere. So quite often it comes from the knee then. So there's more torque on the knee. I don't know if that makes any sense to you, but you're going to have to take our word for it on this
Well,
one.
basically what we're saying is the hip in the knee joints work together. And if one of the joints is tight or has pain,
Yes.
causes,
The other joint is going to make up for it.
listen to this, it causes a compensatory movement to the
Wow.
adjacent joint.
Bravo, bravo.
I'm talking as if maybe we're talking to a whole classroom of physical therapist students. And that's what we may have out here. These people are incredibly bright and they want to be talked to intelligently.
Right. So let's go back to the weakness of the hip.
Okay.
A good strengthening exercise, Brad, is just to, I'm going to, do you mind
Oh,
if I
I'm sorry.
is just to do clamshells.
Yeah.
Because you bend your knees like this and you bring it up, and it's working the muscles of the hip into external rotation.
Right. So, in other words, that knee that's going this way, like Bob demonstrated, it's going to help correct that and take pressure off the knee.
Right. The other thing is tightness of the leg. We have a whole bunch of different stretches you can do for the hip. I wasn't going to show them on this one because
Sure.
it's an entire program that you can do yourself.
Are we going to bring that out in this?
Yeah. Well, why don't you mention that this, by the way, is a series of part of a series of videos on knee pain. And so if you go to bobandbrad.com and go to the program section, you'll find that series on knee pain.
Right.
And if you look through the titles, you'll see some stretches that you can do.
All right, there's going to be 30 or 40 videos on knee pain. The title will be specific to the problem that you're looking for. Look at that video, be 10 minutes long or so. There's a PDF printout. Click on that. It'll print out a review of the whole video as well as exercises so that you don't have to go back and look at us.
Yeah, make sure you take your credit card and pull it out, and then at the end just throw it away because you don't need it.
Yeah,
it's
really.
It's going to be a free program.
We don't even ask for your email. It's completely, there's no strings attached.
Yep. Well, check it out.
Is that it, Bob?
That's
We're all
it.
done?
Yeah, we're already done.
We've hopefully benefited another 14,000 million people.
All right. How's
bazillion.
your math?